Hello. Uh, Today I will demonstrate the scapular region, uh, the superficial muscles of the scapula and the deep muscles of the scapular region, and also I will morely focus on the intermuscular spaces, boundaries and the contents within it. So on the cadaveric dissection, this is the scapular region. So in the scapular region, superficially we have two muscles. This is the trapezius muscle. So I have cut along its origin and I am reflecting the muscle to see the deeper muscles. So this trapezius muscle is supplied by this nerve, this one. This is the spinal accessory nerve. Okay, and this is another superficial muscle which is the latissimus dorsi, and once I reflected the trapezius muscle, you can see these muscles. So these are the three muscles which you see along the medial border of the scapula on the dorsal surface. This is the levator scapulae, this is the rhomboides minor, and this entire thing, this is the rhomboides major. And you know, between this rhomboides minor and the major, when I just made a space between these two muscles, now we can see two structures. One is a nerve, which is, this is a dorsal scapular nerve, and the other one which is a vessel, which is the transverse cervical artery, which is a branch of the thyrocervical trunk of the subclavian artery. So levator scapulae, rhomboides minor, major, all these three muscles are innervated by the dorsal scapular nerve. Okay. Now moving on to the intermuscular spaces. Now this is the deltoid muscle. I have cut the deltoid muscle along its origin on which is taking from the lower lip of the crest of the spine. I have made an incision, I have reflected this deltoid muscle to see the intermuscular spaces. Now here we have three intermuscular spaces. One is the upper triangular space, then we have the quadrangular space, and this is the lower triangular space. Now before I talk about the boundaries, let me be very clear about the muscles. See here, this is the teres minor muscle and this is teres major muscle. This is long head of triceps and this is the shaft of the humerus. This muscle is the infraspinatus, this is the supraspinatus muscle. So coming to the upper triangular space, this upper triangular space is bounded above by this muscle which is teres minor and this is teres major. Both these muscles are seen along the lateral border of the scapula, laterally by the the long head of triceps. So this triangle is the upper triangular space, and within this upper triangular space we are seeing two structures. You know, this is the circumflex scapular vessels. Circumflex scapular vessels are the branch of the subscapular artery, which is in turn it is a branch of the third part of the axillary artery. Now coming to this space, this is the quadrangular space. This quadrangular space is bounded above by again teres minor, below by this muscle which is teres major, medially by long head of triceps and laterally by the surgical neck of the humerus. And this is the four-sided bounded quadrangular space, and within this quadrangular space you are seeing two structures, a nerve and an artery. The nerve is, this is the axillary nerve which supplies to deltoid muscle, and the artery is the posterior circumflex humeral artery, which is again a branch of third part of axillary artery. Then coming to the lower triangular space, this is a lower triangular space. The boundaries are above by teres major, medially by long head of triceps, laterally by the shaft of the humerus, and this is the lower triangular space. And within the lower triangular space again we have the contents, a nerve and an artery. This is the nerve which is the radial nerve, and the vessel is this, the artery is the profunda brachii artery, which is a branch of the brachial artery. So all these are the intermuscular spaces which we see along the scapular region. Thank you.